So how do you see inflammation as a player in the pathophysiology of type 2 diabetes?
So it's a very interesting question, and there are both basic science studies and clinical epidemiology studies that link inflammation to the pathophysiology of type 2 diabetes. Epidemiologically, we certainly know that inflammation is associated with obesity, it's associated with diabetes, it's associated with cardiovascular disease, but not only are they associated, but they precede and predict the development of these conditions, which suggests a potential causal role. Greater evidence, though, comes from the clinical studies where you can potentially target inflammation to interact and stop the processes of the development of diabetes and potentially cardiovascular disease by targeting inflammation itself.
So therefore, in that context, in this epidemics of obesity, sedentary lifestyle, affluent diet, do you see that we could eventually develop approach targeting specifically inflammation rather than weight loss and reshaping lifestyle?
There are certainly animal models to suggest that one can target inflammation directly to improve upon insulin sensitivity metabolism. And I think that one of the most early suggestions of this came from the targeting of TNF-alpha and its pathways. In the human studies, it's a little bit more difficult to actually prove this. There are drugs that have indirect anti-inflammatory effects and target other molecular targets more directly, and there is some suggestion that these may actually be potentially beneficial. The most important of these are the studies using statins, which also have anti-inflammatory properties and may delay the development of cardiovascular disease, specifically in patients who have elevated markers of systemic inflammation. Our work itself is targeting inflammation directly using a subfamily of the nonsteroidal anti-inflammatory drugs, the salicylates, and we have very promising findings that we can actually lower blood sugars and improve adiponectin as a biomarker of improved inflammatory status and potentially have a role in treating patients with type 2 diabetes.